Hi, thank you for joining us for a brief presentation on how to stay healthy in a COVID-19 world. Even though we aren't meeting face-to-face, we are happy that you are able to view this presentation from wherever you may be. Before we begin our presentation, we would like to take a few moments to introduce ourselves and briefly cover the objectives for this presentation. Hi, my name is Alex.
I'm Hannah.
I'm Jasmine.
And I'm Leah.
We are nursing students from Florida State University's Fall 2020 Accelerated BSN program.
In this video, we will be covering the following objectives. What is COVID-19? Then we will discuss current COVID-19 data trends. We will also look at tips and tricks for how to stay healthy, including how to properly wear a face mask, social distancing, and proper hand washing techniques. We will also look at pet safety. And lastly, we will provide some information on where you can get tested for coronavirus here in Tallahassee.
Before we dive deep into our discussion about COVID-19 and what you can do to stay healthy despite it, we will start off with a short pre-test to test your prior knowledge about what we will be discussing today. Don't worry, this is not for a grade.
Question 1, true or false? Individuals without symptoms of coronavirus can still transmit coronavirus. True. Individuals without symptoms can still transmit the coronavirus.
Question 2, true or false? Masks can be worn around your neck at any time. False. Masks should not be taken off your face unless you are eating or drinking.
True or false? COVID-19, aka coronavirus 2019, is just like the cold or flu. False. COVID-19, aka coronavirus, is not like the flu.
Question 4, when at home, it is highly recommended to be blank away from others. 10 feet, 12 inches, 6 feet, or 9 feet. The answer is 6 feet. When at home, it is highly recommended to be at least 6 feet away from others.
Question 5, you should wash your hands for at least blank seconds. You should wash your hands for at least 20 seconds.
So now we're going to be talking about what exactly COVID-19 is. First, we're going to define COVID-19. So COVID-19, aka coronavirus 2019, is the official name of the virus that is resulting in the current global pandemic that we all are facing. It is part of a family of other coronaviruses, but it should not be confused with other viruses that commonly circulate among humans, such as the common cold. The virus is spread mainly through person-to-person contact as an infected person coughs, sneezes, or speaks. These droplets can then land in the mouths or noses of other people, which allows the virus to enter one's respiratory tract, where it can then enter the lungs. Some signs and symptoms of COVID-19 are pretty wide-ranging, from mild to severe, and may appear 2 to 14 days after exposure to the virus. The following list that we're going to discuss does not include all possible symptoms, but people with these may have COVID-19. The CDC identifies these as fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Now I'm going to take you to the Florida Department of Health's COVID-19 Data and Surveillance Dashboard. What you see here is the Florida's COVID-19 Data and Surveillance Dashboard sponsored by the Florida Department of Health. What you can see here is that as an entire state, we have almost 400,000 cases, or to be more exact, 389,868. If you go and hover over the different areas, you can go ahead and choose which county you're in. And so what we're going to do, for example, is go over to the Leon County view. So in Leon County, we have 3,413 positive residents. And broken up by males and females, we have 1,616 males, 1,838 females, and you can get some other types of descriptive statistics too by looking at this page. We can see that right now the majority of the cases range from ages 15 to 24 and 25 to 34, but remember, this is just Leon County. You can even break this up in other counties, or you can look at it from an entire state view. Additionally, some other important information to point out is that so far in Leon County, we have 87 hospitalizations, 13 deaths, and of those residents that are not part of Leon County, we have 67 of those. So really neat stuff that you can look at on this page. You can even look at other counties throughout the state. You can even look at testing information where there's high numbers of testing that's being done, and of those who was positive and negative. So here we also have a state view, and like I said, you can go in to the state as a whole and see, as a state, we have over 3 million people tested, and just like I said earlier, we have 389,000 that are positive. And now we will resume our discussion on COVID-19 and how to stay healthy. And by doing that, we're going to discuss tips and tricks for staying healthy despite COVID-19.
So first, we're going to start by talking about how to properly wear a mask. So what is the purpose of the mask? So the masks help prevent the spread of the virus for those who have contracted COVID-19. Masks protect the person wearing them by acting as a barrier to germs. Masks are most likely to reduce the spread of COVID-19 when they are used in large quantities in public settings. So how to wear a mask. So step 1, you want to make sure you wash or sanitize your hands prior to putting on a clean mask. This is to prevent any initial contamination to your mask. Next, you want to secure the strings around your ears. Make sure the strings fit well. You don't want the mask to feel too tight or too loose on your face. Step 3, spread the mask fully over your nose, mouth, and chin. Step 4, lightly pinch the seam of the mask on your nose to make sure it is perfectly fitted to your face. And you're done. So now we're going to talk about how to properly take off a mask. So step 1, you want to grasp the strings around your ears with both hands and remove the mask, being careful not to touch the front part of your mask or your face. Once the mask is off of your face, you want to fold the outside corners together, being careful not to touch the front part of the mask again. If you're using a cloth mask, you want to place it in the washing machine or a laundry bin at home. However, if you're using a surgical or non-reusable mask, you want to make sure that you properly dispose of it in the appropriate receptacle. And then when and where do you wear a mask? The CDC recommends wearing a mask in public settings and whenever you are around people who don't live in your household. And now we're going to talk about how not to wear a mask. Don't touch or fidget with your mask. This could cause potential contamination and exposure to the virus because your hands may have touched something contaminated. Don't wear your mask solely around your neck. It's important to keep the open areas of your face covered at all times to avoid contracting the virus as well as spreading it. Don't wear your mask solely around your mouth. Our noses can just as easily spread or contract the virus, just like our mouths can. If you ever feel like you need to catch a breath of fresh air from the mask, Try to find a private area to remove the mask for a few minutes. If you're unable to find a private spot, make sure you step away from all persons at least 6 feet apart and then remove your mask to catch a breather. And here's a little infographic to show you the do's and don'ts of mask wearing. And we're going to play a short video for you on how to put on a mask.
Okay, so in this first video, we're going to watch Leah show us how to properly put on a mask. We're going to see her first take the mask by the strings and place them over her ears. She is then going to adjust the mask so that it covers her nose, mouth, and chin completely. And then she is going to lightly pinch the bridge of her nose so that the mask is fit perfectly on her face. Okay. And then in this next video, we're going to watch Leah show us how to take off a mask. So she's going to start by first grabbing the strings of the mask off of her ears and gently pulling it away from her face. While she does this, she's going to make sure not to touch the inside of the mask or the center of the mask, and she's also going to make sure not to touch her face. And since Leah is wearing a surgical mask, she would dispose of it in the proper trash receptacle, but that is not shown on this video. However, if she were wearing a cloth mask, she would simply put the mask in the laundry bin in her home, or she would put the mask directly into the washer. Okay, and that's it.
Okay, now we're going to talk about how to properly social distance. What is social distancing? It's an intervention that controls the spread of disease by physically distancing from other people. And why do you practice social distancing? COVID-19 spreads by droplets, which means it is commonly spread when people are in close contact. This can be done by talking, sneezing, or coughing. Here are some tips for social distancing. Things to avoid would be group gatherings, non-essential appointments, mass transit systems, restaurants and bars, fitness centers, concerts, and sporting events. You need to use caution when you are running errands, getting takeout from restaurants, any kind of public transport, public parks, when visiting high-risk individuals, and traveling. It is safe to take a walk, spend time outdoors, doing yard work, video and phone calls, and home delivery of any food or other items. Some other tips for social distancing and how to stay safe in public would be to wear a mask, stay at least 6 feet apart from everybody, wash your hands frequently, limit contact while running errands, know the local guidelines before you go out, and monitor your health daily.
And now we're going to talk about proper hand washing techniques. So the purpose of hand washing is simply to prevent the spread of germs and prevent infection. And in this case, it would be to prevent the spread of coronavirus. So when is the appropriate time to wash your hands? Before and after eating, before and after preparing food, before and after caring for someone who is sick or may be sick, after using the restroom, after coughing or sneezing, after handling garbage or any other potentially contaminated object. And here are the steps of hand washing. So step 1, you want to rinse your hands with warm running water. Step 2, apply soap and lather it between your hands, including between your fingers, the back of your hands, and under your nails. Step 3, you want to scrub your hands for at least 20 seconds, making sure to cover all areas of your hands. Step 4, make sure you rinse your hands thoroughly. And step 5, dry hands using a paper towel or a clean hand cloth. If you're using hand sanitizer, the same principle applies to hand washing, except no rinsing or drying of the hands is involved. And you also still want to make sure you scrub your hands for at least 20 seconds or until the sanitizer has completely dried on your hands.
Now we are going to talk about some tips to keep in mind when thinking about pets related to the coronavirus. Currently, there is no evidence that animals can spread coronavirus. Pets do, however, have other types of coronaviruses that do not infect people and are unrelated to the current COVID-19 pandemic. However, in a small number of situations, some animals have tested positive for COVID-19 after being in close contact with a human that was positive with the coronavirus. So, what should you do with your pets at home? Continue to practice good hygiene when interacting with pets and animals. Remember, pets still do carry other illnesses that may be transmitted to humans. Restrict contact with animals and people if you are positive with this new coronavirus. Do not wipe your pets with chemical disinfectants, alcohol, or other products that are not approved for animal use. Do not put a face covering or a mask on your pet. And lastly, be sure to call your veterinarian if your pet becomes ill at any time. What about testing for coronavirus in Tallahassee? There are several sites, including drive-up and walk-in sites, to have coronavirus testing performed. For drive-up testing sites, CVS at 1708 North Monroe Street in Lake Ella Plaza or 5466 North Thomasville Road off Cary Forest Parkway are two locations that are offering drive-up testing. An appointment is required. This testing is free for uninsured patients, and it is available for patients who qualify that are at least 18 years of age or older. Remember, patients must perform their own nasal swab at these locations or bring someone to do it for them. Please visit cvs.com to see if you qualify and book an appointment. For walk-up testing locations at other places in Tallahassee, residents can visit the FAMU Bragg Memorial Stadium located at 1500 Wanish Way. This location is open daily from 9 a.m. to 6 p.m. An appointment is required, so please call Leon County Health Department in advance at 850-404-6399. This location is open to all ages, including children below the age of 18 years. Also, individuals can visit Home Depot located in Northwest Tallahassee at 1490 Capitol Circle Northwest. This location is open daily from 9 a.m. to 5 p.m., and they are accepting any patient without a physician referral aged 18 or older. Thirdly, people can visit Patients First located at OneBlood Center at 1940 North Monroe Street. This location is open Monday through Friday from 9 a.m. to 6 p.m. and on weekends from 9 a.m. to 5 p.m. They are accepting walk-in patients with no physician referral required. Most insurance will be accepted with a copay of $0. However, a self-pay option is available and the cost is $175. So, who should get tested for coronavirus? Anyone who is exhibiting symptoms including a fever, cough, shortness of breath, loss of sense of taste or smell, or other respiratory symptoms should be tested for the virus. Also, individuals with a known or suspected exposure to someone who has tested positive for coronavirus. Anyone who has recently traveled from a high-risk area, including Brazil, China, Iran, most European countries, the UK, and Ireland. And anyone that works or lives in a setting where the risk of transmission is high, including long-term care facilities, group homes, and correctional facilities, should be tested for COVID-19. Additionally, if you are interested in having antibody testing performed, OneBlood Center will test your blood donation for free. Donors will be able to see the results approximately 48 hours after donating by logging into their donor portal at www.oneblood.org. Additionally, anyone who was previously confirmed to have coronavirus can donate blood plasma via OneBlood to assist those currently fighting coronavirus. The criteria for donating include: the patient must weigh at least 110 pounds, you must have a normal blood pressure and pulse at the time of your donation, you must not currently be experiencing any symptoms of coronavirus, and you must have been asymptomatic for at least 14 days. Appointments with OneBlood are also required in advance, and you may visit oneblood.org to make an appointment and to find out the location of the nearest OneBlood donation center for you. Now we're going to take a brief post-test to test your knowledge of everything we've talked about today. Question 1, true or false? If someone I live with recently tested positive for COVID-19, I should get tested for COVID-19 also, even if I have no symptoms. True. If someone you live with recently tested positive for coronavirus, you should get tested for COVID-19 also, even if you have no symptoms. Remember, even patients that are asymptomatic can transmit coronavirus.
Question 2, true or false? You should wear your mask solely around your mouth because your nose doesn't spread the virus. False. Masks should be fully covered over your nose and mouth. Our noses can spread and contract the virus just as easily as our mouths do.
Question 3. Approximately how many cases of COVID-19 exist in the state of Florida today, July 23, 2020? A, 160,000, B, 190,000, C, 250,000, or D, 380,000. The answer is D, 380,000 cases, specifically 389,868 cases exist in Florida, with 3,480 of those cases currently in Leon County.
Question 4. Which activity should be avoided? A, taking a walk. B, group gatherings. C, essential appointments. D, public parks. The activity that should be avoided is B, group gatherings.
Question 5, true or false? It is safe to spray my pets and my skin with Lysol disinfectant. This is false. It is not safe to spray your pets or skin with any Lysol disinfectant. Remember to only use products that are safe for human or animal use. Lastly, we want to thank you for your time and remember to stay safe.